perhaps one key message. So get one key message from the panelists. And because Joy is here, I'll take the opportunity to ask Joy to just give us the one key message or the message that she hopes we should take from this discussion, especially with regards to the mental health data prize and the mental health research across the continent. So I'll open it up for you, Joy. I hope you can access the microphone.
Yes.
Yeah, thank you.
Hello?
And apologies.
No worries. Thank you very much. Yeah, technology, these things happen. I
Yeah,
think from this, my takeaway is we definitely need to get into the habit whereby research informs policy. And if this is already being incorporated in the Western world, we can definitely use it as well in the African perspective. And I think this would be more effective in the sense that we will get to be able to get solutions that are culturally adaptive to our societies and be able to create comprehensive policies that also speak to our community needs and our everyday lives. And in addition to that, I think it is important for researchers to incorporate an aspect of communicating or disseminating the information that they get, because we find many a times researchers are probably in silos, and once they have published, it's on to the next one. But how can we get to share and disseminate not just the published paper, but take that paper and break it down in various aspects to tailor to how policymakers would have for maximum impact to various stakeholders. So is it policymakers? How can we our research from our outputs and recommendations, how can we also tailor a message to them? How can we disseminate a message that will be able to reach out even to the lived experience experts, because they need to know you've done research, you've incorporated them in the research, but so how do you come back and tell them about what you found out, or do you just go publish and once you've published in a journal, on to the next thing? So we also need to get into the habit of how do we disseminate our information to go back to help the people in the communities, as much as we're also trying to get it into incorporation in the policy world. We also need to feed back this information back to the communities. And for anyone who's doing any mental health project, or even for the projects that we'll work on, as Mental Health Innovation Network, we welcome all the projects. We're happy to showcase it to our wider community of over 10,000 members and stakeholders. So just reach out to us. We do not charge. It's fully free. We're just providing a platform of dissemination of mental health information, because the only way we can, break through the silos and showcase our work is if we are able to you've done amazing work, now let's show information to the others. So thank you very much. I think you're muted, Sylvia.
Yeah, thank you so much, Joy. I really think you've raised very good points. And perhaps one thing I think for many of us, even researchers, when we do research, and based on your experience around knowledge translation, how perhaps one final comment I would like you to make is around how do we improve uptake of the findings that we have, we as researchers, we even through the data mental health data prize, how do we improve uptake across the continent when we do research?
Thank you so much, Sylvia. I think one of the best ways to ensure there's an uptake, it is incorporating it from the word go in the proposal. How will you, as you're writing, what is the research you'll do? You've done the methodology. Also incorporate an aspect of, how will you disseminate this information? I think once we incorporate it from the get-go in our proposals, that means we'll also allocate some funding for that dissemination plan. We'll be able to ensure that whatever we disseminate will be out there. And I know that many a times everyone will want to create their own website, but remember that at the end of this project, the website will, once you stop having at the end of the funding period and the funding has stopped coming in, where does this website go? It just vanishes and all the content vanish. So how can we ensure a sustainable way for dissemination? Many a time, because for example, MHIN is a system and that has been there for, it celebrated 10th anniversary, and it was also conned by WHO, and we're able to showcase, we create the innovation profiles for the different projects. If you incorporate that, one of the ways that you will disseminate your information is highlighting or creating a profile of your outputs, for example, through MHIN, and we're able to also guide you on various ways on, so you've published your research. So how do we tailor the message from your research to policymakers? How do we tailor your message to donors, to various stakeholders? So I think if we incorporate the dissemination aspect, we'll be able to, when it comes to implementation, it won't just be publication in a research journal, but we'll go beyond the publication in a research journal to how can we now break down the information that we've received in a way that that person in the village is able to understand that, yes, I came and I was asked questions, so what came out of it, and how is that benefiting me? So investing in informed mental health awareness and raising communication strategies from our research outputs, I think will definitely go a long way. And also even offering a capacity building session post the research to showcase that, yes, you brought people for stakeholder workshops on, when you are developing it, but once it's developed, also disseminate it, in one of the same ways to be able to get that uptake, because many a times it's always, you do amazing work and then you published it in a journal. Many Africans are not able to access those journals because they're behind a paywall. So at the end of the day, many people really don't get that access, other than those, your fellow researchers who are also, know where to get this information. But we need to get out of those silos of just, for example, researcher spaces, but this information could also be beneficial to the clinicians, to the policymakers, to the donors, to the service users. So let's be intentional in, in disseminating this information to ensure the maximum output and impact. Thank you.
Yeah, thank you so much, Joy. We don't have Margaret on the line, but I really appreciate your insights and the insights from Margaret around lived experience. It's been a very insightful talk and very many key points to pick up from there, from the aspects around the gaps that exist and why they limit provision of mental health care in terms of the validity of the research, the human-centeredness around lived experience, around the visibility and adoption, the validation of the findings, and then sustaining that lived experience engagement, then the provision of an access, the access which includes affordability, accessibility to care, health financing, and all these health system building blocks that exist that are supported by the work and informed by the data that we collect, or the data that exists, and how we can enhance collaborations for mental health that is encompassing not just the policy, the data, the researchers, but going beyond that and looking at multidisciplinary perspectives and what they bring to the table in terms of the mental health data price, the research that shows that the gaps and also the resources and efficiency that comes with that. And we also recognized the cultural and contextual sensitivity that technology brings, whether it's in terms of the capacity building for both lived experience and researchers, knowing what lived experience brings to the table, but also providing that kind of capacitation to do the work around lived experience. the key role that policy makers play in understanding whether it's lived experience or policy, the different organizations, and where APHRC is coming in to really look at how we integrate and taking lessons from it through the prize. And then all these aspects around how do we deal with the limited resources, how can we get more funding, what is the potential contribution of all of these aspects to the mental health data prize, and more so what could be lacking and why the funding might be low in this aspect, and what we should be proactive about, the safeguarding mechanisms and the proof that that maybe is needed around the policies, but then they exist some proof on some policies and experience with Kenya. So very, very insightful talk and discussions. I think there are so many points from there. We have taken note of your call to action. So thank you so much for our participants who held on to the last minute, but also the main group, because it was such a very fruitful discussion and very engaging and rich. A lot of people stayed on up to the end. We had over 60 participants till the end. So thank you, Joy. Thanks to the participants, and thanks to the panelists, facilitators, other panelists on this call, and the facilitators. Thank you once again, and have a good evening, good morning for some people maybe. And yeah, see you soon. Nice weekend.
Thank you very
Thank you
much.
so much. Bye-bye.
Bye-bye. Thank you so much. Yeah.
Bye.
Bye.